Hello everyone. A 75 years old lady reports urinary incontinence when coughing and sneezing. She has two children with no complication. She has no significant past medical history and she is on no medication. What is the most appropriate initial management? So, though the lady is 75 years old, but she has no significant comorbidity like medical illness or surgical illness like diabetes mellitus, high pressure, kidney disease. There is nothing, and she has two children, and there is no complication. And past medical history normal, and she is taking no type of no medication. So, what is the initial management for this urinary incontinence? Here are the options: trial of sacral neuromodulation, urodynamic studies, pelvic floor exercise for 3 months, bladder drill training for 6 weeks, administration of oxybutynin. So the diagnosis of the stress incontinence, is obvious from the history of the female, and there is no need to bladder diary or urodynamic studies. Usually pelvic floor exercise for 3 to 6 months is the first line management. So let's see the urinary incontinence in details. So what is urinary incontinence? It is the involuntary passage of the urine, and most cases the sufferings are female, that means about 80%, and it has prevalence of 11% when greater than 65 year, and the variants are stress urinary incontinence about 50%, urge incontinence 15%, and mixed type 35%. So most of them are stress urinary incontinence. So what are the management? There are some conservative management, and we should try first the conservative management. And the first option is the pelvic floor exercise. So here the pelvic floor exercise is the first line management for urinary incontinence. And in case of overactive bladder, should have 6 weeks of bladder retraining. Drug therapy may be given. Drug therapy for women with overactive bladder should be offered oxybutynin or sulfenacin in elderly. When there is conservative treatment fail. So the first line treatment of urinary incontinence is the pelvic floor exercise. And the women with the detrusor instability which fail non-operative therapy, then sacral neuromodulation. So when there is failure of the conservative treatment, then sacral neuromodulation may be another option, but augmentation cystoplasty another alternative. In women with stress incontinence, urethral sling type procedure may be undertaken. So it is the another option, which is the urethral sling type procedure. When cystocele is present associated with the incontinence, it should be repaired. So cystocele, that means the urinary bladder wall comes anteriorly and enlarged. In this condition, repair should be the first option. And what is the NICE guidelines? NICE guidelines is the initial assessment urinary incontinence should be classified as stress, urge incontinence, and mixed, and at least 3 to 7 bladder diary. If unable to classify easily, starts conservative treatment. So the conservative treatment always the first option for urinary incontinence, and after that urodynamic studies may be done. And urodynamic study if planned for surgery. In case of stress incontinence, first line is the pelvic floor exercise, and if fails, then consider surgery. In case of urge incontinence, bladder training for more than 6 months. If fail, then the oxybutynin. And pelvic floor exercise also be offered in the first pregnancy. So what is our option? Initial management for urinary incontinence, it is the initial management, never surgery. Initial management always the pelvic floor exercise. Thank you.